the tone decay test. For people with normal hearing, a sustained tone with a frequency within the standard audiometric range remains audible. I repeat, a sustained tone remains audible when presented at a level well above threshold. The key word here is it remains audible. However, for a pure tone with frequency close to the upper limit of hearing, that is well above 8 kHz, the loudness may decrease within seconds and the tone may decay to inaudibility even when presented at a level between 20 and 40 decibel sound level. It decreases within seconds to become inaudible. The tone decay test, also called the threshold tone decay test, is used in audiology to detect and measure auditory fatigue. It is developed or was developed by Raymond Carhart in 1957. In people with normal hearing, a tone whose intensity is only slightly above their absolute threshold of hearing can be heard continuously for 60 seconds. I repeat, with normal hearing can be heard for 60 seconds a tone above their absolute threshold of hearing. The tone decay test produces a measure of the decibels of decay, that is, the number of decibels above a patient's absolute threshold of hearing that are required for the tone to be heard for 60 seconds. A decay of between 15 and 20 decibels is indicative of cochlear hearing loss. A decay of more than 25 decibels is indicative of damage to the vestibulocochlear nerve. Now, how do we perform the tone decay test? A tone at the frequency of 4000 Hz is presented for 60 seconds at an intensity of 5 decibels above the patient's absolute threshold of hearing. If the patient stops hearing before 60 seconds, the intensity level is increased by another 5 decibels and it is repeated until the tone can be heard for a full 60 seconds. So a tone is presented at 4000 Hz and for 60 seconds. If it decays, then the intensity is increased by 5 decibel until the patient hears for a full 60 seconds. The resultant measure is given as decibels of decay, and as earlier said, if beyond 25, it is suggestive of retrocochlear pathology. Tone decay is a powerful diagnostic procedure for retrocochlear pathology, that is, damage to the auditory nerve. Now, this is the chart. Up to 5 is normal, 10 to 15 is mild, up to 25 is moderate, beyond 25 is when marked decay is suspected. Now, that is the tone decay chart. Patients with acoustic tumor frequently exhibit extreme and often complete tone decay. However, the tumor size appears to be related to the severity of symptoms. Partial or complete tone decay was found in 60% of tumors classified as large, whereas 40% of tumor is classified as small. The tone decay test, when the sound presented is not heard for 60 seconds and incrementally increased at 5 decibels until the patient hears for a full 60 seconds. If the patient can hear only after increasing to 25 plus decibels, then the pathology is construed to be retrocochlear. A comprehensive discussion about the tone decay test.